Hello, dear viewers. This is part 4 of continuous renal replacement therapy in critically ill patients. In this video, I will be discussing basic circuit of CRRT therapy and what are the differences in circuit when we deploy different therapies like CVVH, CVVHD, CVVHD-app and SCUF. I am Dr. Sunil Garg from Essentials of Acute Care. This is a schematic representation of basic circuit of CRRT. Blood enters the circuit from here, then it passes through filter where diffusion and filtration as per CRRT modality takes place, and then finally blood is returned to the patient. Here you can see there are three pressure sensors, namely access pressure sensor which measures access pressure, filter pressure sensor measures filter pressure. Filter pressure is not only helpful in calculating transmembrane pressure but pressure drop as well. And third sensor is return pressure sensor. I have discussed all these pressures and their utility in my previous videos. There are four pumps, namely blood or access pump, effluent pump, dialysate pump and replacement pump. Blood or access pump draws blood from the patient through arterial side of dialysis catheter. Effluent pump which manages effluent. Dialysate pump controls dialysate fluid while replacement fluid pump monitor and regulate replacement fluid. Blood or access pump and effluent pump always work in CRRT therapy irrespective of CRRT modality. The use of dialysate pump and replacement pump depends on the type of CRRT modality. There is one hemofilter consisting of semi-permeable dialyzer membrane, tubing through which blood flow in and out of the patient and filter makes a part of CRRT circuit. There are two leak detectors. One is for detecting air in the circulation before blood is returned to the patient and another is blood leak detector before effluent pump to detect any blood filtration through membrane. Before the air bubble detector, there is de-aeration chamber. It removes any air bubble in the circulation and then blood passes through air bubble detector. There is anticoagulant syringe driver connected to the afferent limb of the circuit and anticoagulant reversal syringe driver on efferent limb of the circuit in case patient is on regional citrate anticoagulation. Replacement fluid can be given pre-filter or post-filter alone or simultaneously. Again coming to this diagram, we see what exactly happens in continuous veno-venous hemofiltration or CVVH. Since in CVVH there is no diffusive clearance but only convective clearance, dialysate fluid is not required, hence dialysate pump is not in use. Replacement fluid is essential component of this therapy and which can be given pre-filter and or post-filter. In continuous veno-venous hemodialysis, as solute clearance is only diffusive, dialysate fluid is required. Unlike in CVVH, since no convective clearance, replacement fluid is not required, hence replacement fluid pump is not in use. Here you can see movement of blood and dialysate fluid across semi-permeable membrane is in opposite direction to each other. In continuous veno-venous hemodiafiltration, as solute clearance is both diffusive and convective, both dialysate fluid and replacement fluids are required. Replacement fluid can be given pre-filter and/or post-filter. In this modality of CRRT, all four pump works. In slow continuous ultrafiltration, solute clearance does not occur, and it is done for the purpose of ultrafiltration only. Neither dialysate nor replacement fluid is required, hence only two pump, access pump and effluent pump is in use. So to summarize, dialysate fluid is required when there is dialysis, means diffusive clearance across semi-permeable membrane in response to concentration gradient. Replacement fluid is required when there is hemofiltration to replenish the lost volume. In this modality, where hemofiltration occurs, mode of solute clearance is convection in response to hydrostatic pressure gradient across membrane. There is no solute clearance in slow continuous ultrafiltration. Here I finish. Thanks for watching this video. Please do not forget to subscribe to this channel. See you in my next video on CRRT part 5. Till then, bye and take care.